So I'm very pleased to introduce our presenter for today. So Nidhi Gupta will be our facilitator for today. Nidhi is a registered psychotherapist and certified life coach, working with children, adults, couples, and families. She's also a master's level trained counselor and specializes in areas of stress, trauma, anxiety, depression, and relational challenges. And she loves to empower, inspire, awaken, and motivate others to create meaning in their lives in spite of the obstacles thrown at them. So I'm very excited to have Nidhi present on today's topic of the emotional aspects of lymphedema. I will pass it over to you for the presentation, Nidhi. And I think we just have to unmute, and then we'll be able to hear you. Wonderful.
Great. Yes, Vinita, thank you so much for that wonderful introduction, and good afternoon, everyone. Apologies for us being a few minutes late, but rest assured we'll go for the full duration of the presentation. So today's topic, as Vinita explained, is all about living with lymphedema, the emotional and psychological aspect as strategies for self-care and strategies for emotional well-being. And I'm pleased to be able to present to you on this topic. And as we'll go forward with the presentation, we'll get into sort of more details in terms of what we can do to help ourselves and what we can do to really make sure that we are on top of lymphedema and all of its emotional as well as physical side effects. So, as we know from our previous speakers, Anne Demena and Jean Lamantia, we know that lymphedema can be developed from cancer surgery, lymph node dissection, radiation treatment, and so on. And it can occur either right away or some years after surgery. Anne Demena focused on the physical management of lymphedema, and Jean talked about nutrition for lymphedema. And so my topic today will be about the emotional and psychological effects of living with lymphedema. So as you know from Vinita, I'm a registered psychotherapist. I'm also a breast cancer survivor myself, and I have been living with arm and chest wall lymphedema for the last 3 years now. So there's a lot of personal experiences with this topic as well as professional experiences. For me, it's been an ongoing process of lymph drainage management, healthy eating, exercising, practicing my stress management techniques, as well as my positive emotion regulation techniques, all of which we'll talk about as we go through today's presentation. So I really do hope that at the end of today's presentation, you'll be able to take away at least 2 to 3 self-care strategies that you can start implementing right away and incorporate into day-to-day living. So what happens next? You know, while we know that not everyone is at risk for developing emotional or psychological distress, there are studies that have been done on people living with lymphedema. And they do show that in many cases, when an individual does get lymphedema, the quality of life does decrease, and this can result in many stressors. The obvious one is increased stress levels. And then, of course, the second one is dealing with the pain, the swelling, the discomfort of enlarged limbs or enlarged body areas. Stress comes from also searching for the right treatment options. There's also stress related to affordability or financial stress, especially if people don't have insurance coverage for treatment. And then, of course, there's also that added aspect of, you know, now I've got to fit in time for this new treatment. Maybe I've got to now also allow time for a different diet or a more focused diet. And then I've also got to think about an exercise plan. So maybe I was kind of doing these things before, but now with lymphedema, I understand that there's kind of what we call more work to do. And all of that can lead to negative or disabling thoughts like, I thought I was fine after surgery, you know, I just returned to work, I just can't simply take more time off, or I don't have time for this, you know, I just don't know if I can deal with anymore, or even things like, you know, really now after everything I've already been through. So a lot of that emotional distress can come from some of those negative or disabling thoughts. So where do my recommendations come from in order to be able to be presenting on a topic like this? So first of all, everything that I'm going to be talking about today is based on evidence-based research, and I have linked all of my references at the bottom of each slide. They're all based on the current standard of care. I have an evolved and professional understanding of the emotional, mental, and psychological effects of the body on the mind and vice versa. I have my own lived experiences of breast cancer, mastectomy, lymph node dissection, chemotherapy, radiation, and lymphedema. And I also work one-on-one with clients who are cancer survivors and living daily with lymphedema and its effects. This slide is really an infograph, and it shows you the conceptual model of the biopsychosocial factors influencing post-breast cancer lymphedema. And I like it because it's kind of it kind of gives you sort of the predisposing factors, and then it shows you the bottom three boxes in particular show you, at least the bottom third box in particular, shows you how people who develop lymphedema, in this case it's after breast cancer, often have to deal with psychosocial adjustments, functional health status, and their overall quality of life. In the next slides, I'm going to talk more about quality of life because that's a key measure that we use to check a person's emotional and psychological distress levels and how it does actually affect a day-to-day living. So what is the emotional and social stigma of having lymphedema, and what does the research have to say about it? There is a lot of research out there that has been done on the subject of living with lymphedema. And there's one lady in particular, her name is Jane Armour. She's an oncology nurse, and she's affiliated with the University of Missouri. And she's written, from what I know or have found, at least 125 articles. It might be more than that. But she's very, very well versed on the topic, and she's got much to say about it. And what I've also found in the years that I've been working with my clients is a lot of her research, I'm able to back it up with my own client interactions that I've had over the years as well. I'm just going to read out a couple of key points that you know, I've sort of taken from some of Jane Armour's research articles because I thought that they were good points to talk about today. So, lymphedema and associated symptoms, e.g. swelling, heaviness, tightness, firmness, pain, numbness, stiffness, or impaired limb mobility can exert a negative impact on physical and functional well-being, resulting in diminished overall health-related quality of life. Psychological distress, such as anxiety and/or depression, can arise from perceived abandonment by healthcare professionals. Recent research reports that breast cancer survivors with lymphedema utilize more psychological counseling services than breast cancer survivors without lymphedema. There is a sense of illness permanence and the chronicity of lymphedema, which elicits negative emotions such as fear, anger, sadness, loneliness, and frustration, as well as the psychological distress of depression, hopelessness, and helplessness. There is the aspect of the daily time-consuming self-care for lymphedema, which also causes frustration, depression, and/or anger in patients. The negative self-identity with associated reports of feeling ugly or old or unattractive or disgusted even were ignited by the sense of body image disturbance with the visible appearance of lymphedema, i.e. the swollen arm or the puffy hand or the elephant-sized legs, as a visible sign of a disability. A sense of body image disturbance and negative self-identity is associated with the reality that lymphedema is a lifelong chronic health issue and cannot be cured or hidden. And there are reported negative emotions, frustration, anger, fear, self-blame, tiredness, and sadness, as well as the psychological distress, symptoms of depression, hopelessness, helplessness and or anxiety that can occur. So what's the emotional and social stigma of having lymphedema? And again, what does the research continue to say about this? So often I've heard, and I've had the experience myself of explaining what lymphedema is to people is annoying, distressing, and it feels like a lot of people say, well, you've already had cancer, so you still have reoccurring issues, you know, so just explaining it can be distressing, as well as the physical appearance, wearing of the sleeve, the glove, or the bandages, or any other compression garments makes this disease more visible. There can be a social stigma at work due to reduced abilities. There can be public insensitivity and marginalization that could occur. There's diminished sexuality that I've heard reported by many people. Social isolation, reduced activities, or not able to do the same activities as you were able to do before lymphedema. There can be a financial burden. There can be this feeling of a lack of social supports. And all of these, a combination of these can lead to things like anxiety and or depression or any other emotional issues. So it's really important to know the signs, to recognize what could be happening to you, and to reach out for help. You know, there's no shame in asking for help. If anything, I believe it's an act of courage to ask for help when you know that you can no longer deal with everything on your own. It's really important to know, first of all, that not everybody will suffer from any emotional or psychological distress, even after they develop lymphedema. So I really want to make sure that we know that not everybody's at risk for it. However, there are risk factors, and I think it's really important that, again, everybody is well versed on what those risk factors are so that they can understand how they might be affected by their lymphedema, and sort of that might lead to some sort of emotional and or psychological distress. So it also will help you to utilize coping strategies, and the earlier you're aware of it, the earlier you will develop these coping strategies, and the easier it becomes to manage the effects of lymphedema. So the people that are prone, you know, could be anybody that has previous experience of anxiety, depression, or chronic worrying. They have increased risk factors to developing any emotional or psychological distress. Also, anyone with a genetic predisposition to anxiety, depression, or any other mental health issues may also develop these symptoms. Someone who might have an inability or a decreased ability to manage stress, or often has ruminating thoughts. Someone that may suffer from irrational thoughts and beliefs or has reoccurring negative thoughts may be at risk. An inability to effectively regulate or normalize intense emotions or feelings. Someone who may feel uncertainty about their future, or they may fear, or they may have experienced job loss, or may fear career dissatisfaction. Loneliness is quite a big risk factor. Loneliness, lack of support, or some sort of financial stress. Also, low self-esteem can occur after cancer and or with lymphedema, a sense of a loss of independence, an inability to enjoy things anymore. Sleep, that's another big risk factor. Sleep dysfunction or poor sleep hygiene can also really affect emotional and psychological distress. Relationship issues that can affect sex and intimacy, or create a negative body image, which also leads to insecurity in the bedroom. That's quite a common theme that I hear. About, and feelings of anger, feelings of avoidance, minimizing, denial, fear, panic, guilt, sadness, blame, feelings of being hurt, carrying baggage from your past, any unresolved family of origin issues, these can all lead to a person developing or being at risk for developing any sort of emotional or psychological distress. So, as I've said before, know the signs, know yourself, and I'll talk about that a little bit later as well. There can be so many emotional challenges after getting a diagnosis of lymphedema, on top of everything else that you've been through, or on top of everything else that you might even still be dealing with. And all of this can take a toll on your emotions, your health, your time, and your relationships. So it's really important to know yourself. By this, I mean, notice any changes in your mood, in your emotions, in your body, in your sleep, in your activities. And, you know, here's just a quick checklist, as I like to put it, as, you know, things to keep an eye out for. So irritability. Are you getting irritable for no apparent reason? Anger. Are you quick to anger? Again, for no apparent reason. Do you get defensive if someone says something to you? Do you notice yourself avoiding doing things that you need to do? Are you minimizing either your feelings and or your behaviors? Is there any denial of feelings or actions? Do you often feel sad or unhappy or unmotivated? Do you find yourself blaming others for your illness? Is there an inability to let things go? Are there feelings of, why me? Why did this happen to me? Are you carrying around feelings of being hurt by someone or something? Are you carrying baggage from your past, such as previous relationships, romantic relationships, or the final line? Do you have any unresolved family of origin relationship issues? So this would be a good checklist to keep on hand to just see whether there are any risk factors that might be occurring for you. So strategies for day-to-day living with lymphedema. This is really, the key slide for today's presentation. And how do you deal with the emotional and psychological challenges of living day-to-day with lymphedema? And all of these recommendations are based on the evidence-based research that I talked about earlier, current standard of care, my own lived experience of living with secondary lymphedema, as well as my client interactions in my practice of psychotherapy. And I often will use a combination of all of these strategies with my clients, and it's sort of often, let's try this, let's start with this. If this isn't working, let's switch it up and let's work on that. Everything that I've mentioned here are all proven strategies to help. It's an exhaustive list, but at the same time, there are so many other things that can be added to this, and every individual is unique in their own needs and wants. So feel free to add to this. The handout that I sent out earlier, that Vinita sent out earlier, also you can add to that list. So you've got your own personalized, if you like, checklist available to you. So, boost activities of well-being. That would be number one. Activities for well-being include things like journaling, include things like yoga, include things like walking, mindfulness, art therapy, breathing exercises, relaxation exercises. So all of these are proven strategies to help boost well-being. And I've got lots of handouts at the end of today's presentation that you can click on and keep as well, that really speak to this particular first point here. You could also add meditation to that. So that's another great strategy. Mitigate stress. It's so important to mitigate stress and keep stress at bay. And some of the things that you could do to help mitigate stress would be to stay active, to stay social, not isolate yourself, Laughing, some of you might have even heard of laughing yoga, very, very effective, but just laughing in general, just keeping an uplifted sort of hopeful mindset, doing things you enjoy, returning to do things that you enjoyed before you had lymphedema, before you had cancer maybe, are great reminders of how we can enjoy life again and find that happiness. Use positive affirmations, maintain a positive attitude, release any old baggage that we might be carrying around with us, and stay hopeful. Third point here is find your joy. I love this one. I love that word joy, because the minute I say it, right away it imbibes these feelings of joy and happiness, and it sort of ignites my inner child or my younger self right away. So this is very individual for everyone. As I said earlier, different things make different people happy, and that's absolutely fine. So experiment, try out different experiences, and find one or two at least that work for you. So for example, some people find happiness in their work. Great. If that's what makes you happy, if that's where your joy is, great, go for it. For others, it might be being outside in nature. For some, it's their pets. For some, it's joy in volunteering. For others, it's joy in children and or grandchildren. It could be reigniting an interest in singing, dancing, finding spirituality, setting goals. I know for me, during cancer and post-cancer, setting goals were really the thing that got me through my whole journey. I guess being a psychotherapist, I do often work with a lot of goal setting with my clients, but when it came to me having lived experience, I realized actually how valuable and how important it was, for me in my own life, to get me through to every next stage that I needed to get through to. Finding a hobby, often I find that without a hobby or without something to look forward to, there can be that lack of motivation. Socializing more, joining a club of some kind or starting a club of some kind. So the list is endless, as you can see. Add to it, find something, do something that you believe is going to boost your feelings of well-being, joy, and happiness. And the last one is change the narrative. Change the narrative. It really, by this, what I mean is change the internal narrative of your life, which means changing how you think about yourself, changing what you say about yourself and your life. And this includes your past and your future, right? Change how you view yourself currently and in the past, and adopt a more positive attitude. Change your perspective to a more hopeful and positive one. We know there's so much research that has been done that shows positive thoughts, positive attitudes, positive affirmations can absolutely have such a positive effect on the mind and on the body. As I said earlier, there's that real importance between mind-body connection. So changing the narrative, redefining your life, living in the present moment is really important. So the importance of emotional self-care. I love this quote by Socrates, who said, "Know thyself." And by this, I mean, know your challenges, know your symptoms, know your mind, know your emotions, know your body, know what you need, and don't be afraid to seek it out. Spread awareness on lymphedema. There are a few people, there aren't enough people out there that know about the after effects or even know what lymphedema is and how distressing it can be for people. The Lymphedema Association of Ontario, be part of their fundraising efforts if that's something that honors you. There are so many amazing organizations out there, as we know about Wellspring, Lymphedema Association of Ontario, and Amena Jean Lamantia of the Markham Lymphatic Center. They're all out there to provide you with help. So it's so important to reach out if you need it. As I like to say, angels come in many forms, so watch out for them. So that brings me to the end of today's presentation. I want to thank you all very, very much for your time today, for listening. And I really do hope you've picked up at least 2 to 3 strategies that you can incorporate into your life starting from today. I do have a number of articles, handouts, mindfulness techniques. They're all on my website. And these are the links that I've got listed here. Maybe Vinitha can put them, I don't know if there's a chat bar or a Q&A section, so that you've got access to them right away. As well as if you have any questions that you want to ask of me, all of my personal information is here as well. Vinitha, on to you. Oh, seems like. Okay, I'll keep this slide up just for a bit longer until Vinitha comes back on. And you know, there's a great article that there's a link to, which is the relaxation and mindfulness techniques. Goes into a lot of details around ways to boost your emotional well-being, which was on the previous slide. So definitely download that if you get a chance. And here is Vinitha.
Sorry about that. It just
okay.
There was something else that came up, but perfect. So our first question now. Thank you for that presentation, and we'll just move on to our question and answer segment. So our first question: what are some examples of family of origin issues?
Great question. Yeah, great question. So by family of origin, first of all, I should mention that family of origin relates to the family that we grew up in. So it would relate to siblings, parents, or primary caregivers. So family of origin issues could be things like either not having access to all of the things that maybe other children or your peers did, feeling that you weren't dealt with fairly either by parents and or teachers and or other caregivers. It could be just family dynamics, how parents related, how the family related with each other, i.e. parents' relationship and then their relationship with their children, as well as in general, how you as a family operated and how you interacted with other friends and or family. They could have all had either a positive and or a negative impact on you growing up. That could become, that we would call a family of origin issue, something that either has not been processed and or healed, released and let go of.
Okay, thank you for that. And so our next question, does EMDR help with trauma of having this condition?
Yes, EMDR definitely has got proven results of helping with trauma, for sure, yes.
Okay, perfect. So another question, let me see here. So I just see someone that mentioned they didn't get the handout. So there was a handout, a resource pamphlet that was sent out earlier this morning. So if you have not received it, I would suggest you can either check your junk folder in case it did end up there, or please feel free to send me an email at vinitha@wellspring.ca, and I'd be more than happy to resend that to you. And so our next question, how do you deal with lack of motivation in regards to self-care and wearing compression garments?
Right. So if I understand the question correctly, what you're asking is sometimes there can be this lack of motivation to putting on your compression garments and sort of a bit of lethargy associated with that. I think that's what I'm understanding is the question. So, you know, I think it's always important to think about, you know, the end goal. Why am I doing this? What is this for? So yes, it's for short-term gain to make sure that the symptoms don't advance or get worse. But think about yourself in a long-term aspect of saying, you know, the more I get used to this, the more this will become habitual, a bit like brushing our teeth. You know, we've done it from such a young age. We do it every day. It's now become second nature to us. So will bandaging, sleeves, compression garments, and that sort of thing. You know, that you no longer think about it. It just becomes another thing that you incorporate in your day-to-day activities. So that initial motivation spurt is definitely needed and necessary, but always talk to yourself with kindness, love and compassion, and say, it's okay. We know that this is a struggle, but we've got to do this because this is going to benefit us in the long run. And this is what's going to help us moving forward in our lives, manage our lymphedema symptoms.
Thank you for that. And so our next question is something that I think a lot of people might relate to as well. So this individual struggles with the fight that they have with the medical community to get the recognition that lymphedema needs. So getting forms filled out for ADP are very detailed. They require this individual to see numerous professionals, and it's a lot of work. So it's very hard to do when you are lacking the motivation and you might feel lousy. So the question here is, what can we do to get the medical community to be more supportive of this condition?
Yeah, I absolutely empathize with you. I had exactly the same experience. My oncologist didn't even know or didn't even diagnose my lymphedema. Thankfully, I just happened on it by chance, and so grateful that I attended a presentation where Anne Demena was speaking, and it was like everything clicked into place. So absolutely sympathize and empathize with you. Those forms are very, very arduous and onerous. And really, you know, the best sort of advice I have is keep going, don't give up. It's very expensive. The garments, as you know, are very, very expensive. Any help that we can get from the government is a help. So keep going. Keep motivating yourself, keep telling yourself, yep, I'm going to get this done no matter what. And just approach everything. You know, when we're faced with, you know, forms that I know that packet of forms is so big and so large, approach everything in bite-sized chunks. So break it down in terms of, okay, I've got to work with this one fitter or developer or specialist first. And I'm just going to see it as, yes, I'm going to work with that person first and get that portion of the forms filled out. Once that's done, then I'll move on to the next person, and so on and so forth. So breaking things down into bite-sized chunks actually removes this whole panic or fear associated with, oh my God, it's so much, I can't do it, I don't want to do it. And that leads to that lack of motivation or sort of helplessness. So breaking things into bite-sized chunks, I find, is very helpful.
For sure. Thank you for that. And so our next question, would you be able to tell anyone joining us today about any lymphedema support groups that you might know of?
Great question. I don't know, but I'm hoping that Dolores might, but I do also know that there's lots of initiatives that the Lymphedema Association of Ontario does have. So that would be a great website to check out for this.
Okay, thank you for that. The next question, would you be able to, it seems like there's a little bit of confusion around people when they have symptoms of lymphoma versus lymphedema. Would you be able to speak to a little bit about how to differentiate between both conditions?
No, I'm not well versed on lymphoma to be able to professionally talk about it. Sorry, that's not my area of expertise, but I do understand. I do know that there is confusion out there for sure. I'm just not well versed on lymphoma to be able to talk about the differences.
Okay, so our next question, the initial experience of putting on compression sleeves is very challenging. What is some practical advice to overcome the challenges associated with this?
I know. Never. I think what I realized, firstly, from my own experiences, I never gave myself enough time to put on my sleeves. I had to put on stockings, I had to put on a glove and all of that. I never gave myself time. I kept thinking, I was still, because we're habitual creatures, I kept thinking that, yeah, if it takes me, whatever, half an hour to get ready, then it's going to take me half an hour to get ready, without adding in or factoring in the extra time that it takes to actually put on, because it's not an easy process, especially as a beginner. So I would say definitely add on more time. That will alleviate the stress. That will alleviate also, as well as that, the feelings that go with, oh, I don't want to do this. Why do I have to do this? This is such a pain, etc., etc. So add on at least 15-20 minutes extra, you know, and give yourself that extra time. And if you do notice yourself getting stressed, that positive self-talk is so helpful and so valuable. Continuing to talk to yourself with kindness and compassion and saying, it's okay, it'll get done. We just have to be patient. We just have to do this. This is so important for our well-being. And just continuing to self-motivate yourself with those positive affirmations and that positive self-talk.
Mm-hmm. And so our next question, one of the aspects that people might face with lymphedema, stress might be one of the emotions that they do experience. So for people who, it looks like one of the questions we have here, for people who might indulge in sugary sweets or have other behaviors to cope with that stress, is there something that they can use to replace this behavior or a better way to cope with this stress?
Yeah, so, you know, sugary sweets, carbs, anything that converts to sugar, it sort of gives us these immediate feelings of well-being and or happiness. So that's why we, myself included, will revert to sugary sweets and things like that, because we want to feel good. We don't feel good in the moment. So we want sort of this, we want to be able to ingest something that gives us that instant feeling of happiness or well-being. Resist the urge. Easier said than done. Resist the urge. So rather than right away reaching out for something sugary or sweet, grab a drink instead. Distract yourself. I find even in the moment, if you can just distract yourself, i.e., you know, go and look outside of a window, turn the music on. If you live in a house and you can walk out, just stand at your front door, that resisting that initial urge to grab the sugary sweet or drink can actually make you not need it or not want it anymore. Mm-hmm. And then, you know, other longer term strategies, those would be more immediate strategies, but longer term strategies would be things like, okay, so doing that sort of self-reflection work, doing a little bit of self-insight work of, why do I want that sugary sweet? What's going on with me emotionally? Because it's an emotionally driven need that we have that wants me to get something to self-soothe. It's a need to self-soothe. There's a need there to self-soothe. So have things like, do some journaling, just do some self-reflection. The other thing is I always have in my fridge cut up ready-made healthy snacks. So rather than reaching out for that sugary sweet, I know that I've got other healthy alternatives at the ready as well. So being prepared. It was a bit like the question that was asked earlier, you know, how do I make time? Just prepping in advance. I find even healthy eating, prepping in advance really helps me out. It really mitigates my stress, keeps my stress at bay.
Mm-hmm. Thank you so much for that, Nidhi. So I think that about wraps up our question and answer segment. Thank you again for your support in this series and for your presentation and sharing your stories, and for everyone who did join us today. And with that, if there's nothing further to be added, I wish everyone a wonderful rest of the day and to take care of themselves during this time.
Wonderful. Wonderful. Thank you, Vanita. Thanks to Wellspring.